Today we're discussing healthcare delivery in the U.S. Just like all of our classes this semester, here are our objectives for today. We're going to talk about health insurance and how that connects to issues facing hospitals today. We're going to talk about why there has been an increase in ambulatory care sites. We're going to discuss benefits and disadvantages of urgent care and also explore the differences between long-term care, hospice, and hospitals. Okay, so what I'd like you to do is, as you go through the lecture, you'll be asked to answer some questions. I recommend you answer them as you go through. Then at the end of the lesson, you post your answers using the assignments tool. And then the answers themselves will be posted and reviewed next class, either online or in person, depending on how much I think we need to go over them. All right, so this is not related to the objectives. This is from a few classes ago where we were discussing the cost of healthcare in the U.S. and why the U.S. spends so much versus other countries. And there was this question about how is it that so much government money goes towards health if we don't have universal healthcare or we don't have national insurance. So just to refresh your memory, we looked at this a few classes ago, and this shows the U.S. we're all the way on the left, and these are our peer countries, and how much of their GDP goes towards health, and we're this really pretty drastic outlier where 70% of our GDP goes towards health. And then the dark blue is government / compulsory, so required, and then the light blue is volunteer out of pocket. So you see that the U.S., we spend a large proportion of our healthcare dollars are government money. And that's kind of similar to countries that we consider our peers, right? But it's also interesting to note that even just government spending and compulsory, we're spending more than other countries, right? And we talked before, we get sort of less bang for our buck. So there's a question of how could we be spending so much government money? And data from 2013 shows that even though we don't have national health insurance, we do have government health care programs that target certain sectors of the population. So of this government spending, about half of it goes towards Medicare, about 40% goes to Medicaid, and then the rest goes to other programs such as CHIP, Veterans Health, Indian Health Services, and other smaller items. All right, so moving on to today. So I would strongly encourage you, if you haven't done so already, is to read the chapter. Read chapter 15 on healthcare delivery, and a number of pages in there are dedicated to discussing issues facing hospitals today. And the book goes into pretty good detail, right? So one thing is for-profit versus not-profit hospitals, and I just want to highlight that not for-profit hospitals basically don't exist in many of the countries that we've been looking at, right? That in the film, and the textbook reading too, right? Because in other countries there are rules that you cannot make a profit off of medical care, though there's still competition, right? Even though it's a not-for-profit. And so I encourage you to read the chapter. It lays out pretty clearly what some of the concerns are. Another big issue that come up was effect of large hospital chains, the survival of public hospitals, reconfiguring patient services. So the textbook talks about the use of hospitalists, right? And this is a relatively new thing, right? It used to be that physicians would go, you have a physician with a private practice and they would go and see their patients in the hospital, and now we have these specialists. Another issue is use of the ER and how to use that more efficiently. Another concern is dealing with Medicare readmissions, and the one thing I wanted to chime in about that is that this is a pretty big area of research, right? Makes sense because Medicare is a big part of our healthcare spending, as we just talked about. But there's a lot of unknowns, right? So a lot of people are studying this, but we really don't know why it's happening, and it's a little unclear of how to fix this. And then the other issue that came up was medical errors. So what I would like you to think about, right, now that you sort of know about these healthcare issues, but also think about what are some of the problems facing U.S. hospitals, and can you think of some solutions? Can you think of some ideas to help resolve some of these issues? And in particular, how do you think that expanding access to health insurance, for example, through the current law, through the Affordable Care Act, or maybe Medicare for All, which is some presidential candidates are interested in that, how could that help? So what I'd like you to do as you're writing down your answer is try to be specific, right? So go back and think about the problems, the issues facing hospitals today, and identify it, describe what the problem is, and also generate a solution. And this is also good practice for, excuse me, for the final exam.